now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, my friends, how is the health care in the Greater Hazleton area? From a scale from 1 to 10, I'll give it a 12. And we're going to find out why today I'm going to give it a 12. My guest today is the main man at the Greater Hazleton Health Alliance, a good friend of mine, Jim Edwards. The CEO is going to tell us all about the great things that are coming in the Hazleton area. And we also have here, Jim, it's always nice to see you.
Good to be here as always.
So you're a busy man, huh?
Very busy man, yes.
A lot of great things are happening in the Greater Hazleton area. As you know, Jim, back in the 60s, or excuse me, in the 90s, probably the only person that was on television talking about the health care and how great we have it was me. And I stand by that because I think we have, and we'll get into, you know, the providers we have, the doctors, the staff, the nurses, the aides. They're all great. They work very hard in the system, and you can see, you know, the results in our area. But, you know, when you came on board, you had a mission statement, so to speak, as to what direction you wanted to see us go in the Greater Hazleton area. What was that?
You know, we wanted to improve the quality care, the access to care. We wanted to stabilize the system financially so that we could provide that access to care and great quality care, not only for the people that are here now, but for generations to come. And that was 9 years ago. That 9 years sometimes seems to be a very long period of time, but it's really been a relatively short period of time that we've really been able to turn things around from a quality perspective, from an increase in access perspective, and clearly from a financial perspective as well. So we're very pleased with the results that we've had, and we look forward to continuing to serve this community well into the future.
When you're looking at the healthcare and when you recently, of course, we had the merger with Lehigh. Talk us to that. What was the reason why, you know, you and the board decided to make this merger?
You know, I have to compliment the board. The board is all about the community. They are community members. Their families are receiving care. They're receiving care in this community as well. And it's really a testament, I think, to their foresight, their vision going forward to say, how are we going to provide great care not only now, but for generations to come? Healthcare is changing. It's going to become more and more difficult for small health systems like ourselves to be able to continue to provide that high level of care. Right now, we're providing the best outcomes for our patients in the state of Pennsylvania, and that's terrific. Financially, we're doing very well. That's terrific. But as time goes on and we look at 10 years out, 20 years out, 30 years out, I think the board took a perspective to say that we need to do what we need to do, and if there's the potential to partner with a larger health system that shares the same values that we share in providing great access and great quality care to all members of the community and really growing the programs and providing the services that should be provided in this community so that people don't have to travel. We had worked with Lehigh Valley over the last probably 7 or 8 years. Their emergency room physicians staff our emergency room. They're all board certified emergency medicine trained physicians, and they've done a great job. We have our MI Alert program that's meant a huge difference in the treatment of many of the heart attack patients that we have coming into our emergency department. Stroke Alert, Teleburn, tele-infectious disease that we have now. So we felt very comfortable with Lehigh Valley that they shared those same values, that were financially strong, and we've had the ability to be able to work with them on many programs. So I and the board felt that this was going to be a very good fit, and that's why we've moved forward and been able to work out what I think is a very promising future from a healthcare perspective in this community.
So then what can the community expect in terms of better health care with this merger?
I think they can expect just more improvements. I think over the last 8 or 9 years, we have seen such substantial improvements in access and quality of care here in Hazleton. I mean, most people don't know from a patient outcome standpoint, we are #1 in the state in patient outcomes, and we're in the top 25 in the nation. Okay, so we have done things really well. What this will allow us to do is to take our plans for the future and really be able to accelerate those. We've got a very strong partner now, one who is here not to do anything to us, but really to help us achieve the things that we want to achieve and the things that we need to do very well. So I would think that we're going to continue to have the great care that we're providing, but I think over time it's going to become much more robust. There will be new programs that are existing will be built up. So more and more people can feel comfortable that they can stay here in Hazleton to get their care rather than leaving this community to get the care.
So when you're looking at, we're all concerned about care. That's the most important thing. When you're looking at identity, okay, will we be losing our identity? It'll be Lehigh Valley Hospital, or will we still maintain our identity?
I think we're going to maintain that identity. I mean, people have asked me, what's the name of the hospital or the health system going to be? And there have been no conversations regarding that at this point in time. But I can tell you that in my conversations that I've had with the leadership and the people that I've interacted with very much over the last year or so, that they understand that we have done really a tremendous job in achieving what we've achieved here, that we are doing really great things. And they acknowledge the fact that there is much that they can learn from us as well as we can learn from them. So I don't think they're coming in here to try to say, hey, we're going to make radical change. I think you will see things that will evolve over time. There will be a lot of thought put into the changes, but I think clearly the fingerprint, the identity that we have here as a health system will be uniquely Hazleton.
Some of the key things that we are enjoying right now, you just mentioned, but what will be the additional things that we will be able to enjoy in terms of healthcare with this particular merger?
You know, I think if you look at the track record that Lehigh Valley has, they haven't done this a lot. They have not been, like many larger health systems out there, in acquisition mode that are acquiring lots of hospitals. But about 12 years or so ago, they did acquire Muhlenberg Hospital. And if you look at what Muhlenberg was at that point in time, okay, it was very similar to what we are today. And when you look at what Muhlenberg has become and how they have really built up the system there and the things that they have done to make that a much more robust facility and campus and able to serve that community in ways that they were never able to serve them before, I think when you look at that, I think that's what you're going to see here. I wouldn't expect that, okay, on day one you're going to see radical changes and all kinds of new programs, because I think if we do that, there can be a lot of mistakes and wasted money along the way. But I think over a period of time, if you look at this at a 3-year, a 5-year, a 10-year time horizon, I think you're going to see greater access to care. I think you're going to see physicians brought into this community either on a full-time basis or a part-time basis to provide care here that heretofore patients have had to leave this community to get those types of services. So it's going to be access to services here, and I think it's going to be building up the services and then adding those services that really make sense in a community our size. Not saying that we're going to be doing things that really a hospital our size should not be doing, but the integration of care that we're going to be able to achieve with really being part of the Lehigh Valley Health Network, I think is going to be very crucial too, because now we're two separate entities. We work together on various clinical projects. When that integration is then seamless and we are part of that network, I think the communication from a technology standpoint, from an information technology standpoint, just from a familiarity standpoint, is really going to provide seamless care. So for those services that are provided here, the access to specialists and other resources that we need here in Hazleton is going to be seamless, and through technology be very readily accessible. And conversely, when it's a service that needs to be provided at a larger tertiary quaternary care facility, as Lehigh Valley is, I think we're in a situation where that communication is going to be better, and patients are going to be able to come home for their follow-up, which is going to make it more convenient, and also it's going to reduce the cost of care. And I know that's a very hot button topic this day, is how do we reduce the cost of care without impacting the quality? That has everything to do with why we're moving into this too. We're already a low-cost provider, but I think this is going to allow us to be able to reduce those costs further as we go forward and be able to manage the care and manage the health of populations much more effectively than what we would have been able to do otherwise.
Staying on that particular thing, you, Jim, you're a very hands-on guy, okay, as a CEO, seriously. And that's what I think I respect about you the most, is because meeting you and following you throughout the years and doing the different shows, I see that, as a CEO, you're not up in an ivory tower. You're hands-on with the people, you're hands-on with the professionals, and I think that's important, because people sometimes, every time when I would say in the 90s, folks, we have great doctors here, we have great facilities. I get calls, Sammy, I'm going out of town. Now I don't get as many calls like that anymore. Okay, and that's good, because we have opportunities here, I think, that people do not know we have, Jim. Now, the reason I said you're hands-on, being hands-on as a CEO, I think is critical, because I think then you become aware of the different facets. Like if someone says, I was up in the emergency room, I had to wait 4 hours, okay, or I had to wait 3 hours or 2 hours. Well, I don't know how, what is, the system there, but I think you've had, some concerns, but you've cleaned that up, haven't you?
We have cleaned up a lot of that. Not only am I very confident that the care that we're providing in our emergency department is second to none. We're the best in the region. There's no doubt about that. Okay, the quality is there. But when you look at our wait times, what we call our average length of stay in the emergency department is the time from when a patient actually walks through the door of our hospital until they're to their final disposition. That's either being admitted to the hospital, okay, being discharged from the emergency department, or being transferred to another facility if that's appropriate, is below what the national averages are. We're not satisfied with that. We're continuing to move down to try to get to what we call best practice, which is where the best hospitals in the nation are, and we're continuing to shave time off that. Unfortunately, emergencies aren't scheduled. You can come in for a surgery and you're going to have your surgery at 10 a.m. on Tuesday. For emergencies, there's an ebb and flow to that. It's the most expensive department that we have in our hospital, so providing the right amount of resources and balancing the things that we need to do there is very important. But I can tell you, we're doing it better than anyone else in the region right now.
So the community understands, when someone goes to the emergency room. Now, my wife's a registered nurse, so she understands all the triage and whatever the system is. But some people say, first of all, when you're going to the emergency room, it's an emergency. To the mother or father or the guardian who has a kid who's maybe bleeding nose or cut themselves, that's an emergency. However, there may be someone that just had a heart attack or something serious. How does that process work so people understand that, they're not ignoring you, but there's a system that works there, right?
That's absolutely correct. We triage patients, which means that we take those patients who have the most severe illnesses or injuries and they are seen first. So it's not a first come, first serve. It's really prioritizing those patients whose care is needed most urgently. It doesn't mean that we don't want to care for everyone on a timely basis. And when you look at it, I think the overwhelming majority of the time, we are providing that care to everyone on a very, very timely basis. But of course, there are those times when, we may have people who have strokes, heart attacks, car accidents, different things that occur, that those patients, they are absolutely true emergencies and they're in life-threatening situations that if we don't care for them immediately, we are truly compromising their care and really risking chance of death in those situations.
Quality of care, okay, and everyone, again, I applaud you in the fact that you've been able to attract even additional doctors and medical people coming into this area. As I interviewed a lot of them on the show, as you know, they're all very happy being here.
We're happy to have them.
Yeah, really. I mean, the doctors, Colvin, Hockman. I don't want to leave anybody. All these doctors I've been interviewing. And I always say, why did you come here to Hazleton? And they'll tell you that. But what do you look for, Jim, when you're going out attracting the great doctors that we have in this area?
It all starts with quality and training and experience. We look at that first, and that's the first thing that we look at, and that's really what gets them here to Hazleton. We look at lots of resumes, talk to lots of physicians, and we select only those that we feel are the best of the best. We turn away a lot at this point in time, and that doesn't mean that, hey, we don't need those physicians, but we're uncompromising in our pursuit of quality. So once they've passed that quality bar, that we look at it and say that their training has been exemplary and their experience has been very good and there are no problems in their background, then we bring them here to see, are they going to be a good cultural fit? For us, they have to really live the mission that we have here, which is really caring for everyone, being all about quality, doing the things that we need to do to provide the access to care and the quality to care in a manner that we feel is going to be what we expect out of our physicians. And what we expect out of our physicians is meeting or exceeding the expectations of our patients. That's really what it's all about.
As in any business, we always are, we have reviews. And we, look at our employees, and sometimes we have good managers, bad managers, etc. And we have, you're not meeting up to our particular quality standards here, and we have to let you go. In the medical profession where you sit as a CEO, Do you do these reviews? I mean, do you check, do you look at your doctors and your, the people who are involved in your medical operation?
Absolutely. I mean, that's constant. I mean, we didn't get to be #1 in the state in patient outcomes, top 5% in the nation in patient safety 5 years in a row. When you look at how we rank amongst hospitals, not only regionally but in the state and nationally, we are a top hospital from a quality perspective and have been for the last 4, 5, 6 years. You don't stay at that level without really focusing on quality every day. And for us, we're in a business where that quality really begins and ends with the quality of people that we have, their attention to detail, their training, what they do each and every day. I know I talk to each group of new employees that we have during their orientation. And when I talk about expectations, I tell them all that, I try to keep it really simple. I expect your very best each and every day you're here because that's what our patients expect and deserve as well. So we're constantly monitoring that, doing the things that we need to do, looking at where we may be coming up short or if we do have problems from any perspective, looking at that very critically and saying, how can we improve in those areas? And we find ourselves never being satisfied with where we're at. I'll give you an example, our MI Alert program. When we first started that, we were looking at being at just about 2 hours or so from the time that the patient came into our emergency department till the time that they had been transported to Lehigh Valley. We're in the cath lab with a balloon up across the artery. Okay, that was unacceptable to us. We brought that number down. We were at an hour and a half. You look at 90 minutes, that's better than most hospitals are doing that have an in-house cath lab. We've kept pushing and pushing and pushing. We got to a point where we had a 61-minute, we had a 52-minute. We kept working to where our record right now is a door to balloon time of really 41 minutes, which is just exceptional. Why is that important? Because when you're talking about an MI, time is very critical. The more quickly you can get that patient and get that treatment and get that artery opened up, the better the chance of outcome, the better outcome is going to be. So to get it to 41 minutes is really exceptional. That didn't happen by us not looking at every detail of every MI alert we had very critically. And we do that in all facets of the care that we provide so that we can continually try to find ways that we can improve the care and keep raising that bar. And by doing so, we've not only raised the bar for ourselves, but ironically, I think we've raised the bar for other hospitals in this area and other hospitals in the state that they see what we're doing. And I think that's, in some ways, refocused their efforts to provide better care as well.
When you're talking about the quality of care, I had the occasion of being at the hospital in January, and I look at the nurses and the aides and all the people that are working there, and I got to tell you, Jim, I admire them. I really do. I mean, there's a lot of stress put on them because every patient's important, and every patient is wants to have their whatever they want at that particular time. And I got to tell you, all the nurses up at that hospital and all the doctors and especially the aides, they're just great. I mean, they're tuned in, and I could see sometimes the stress on their faces, and but they do their job, and I think that's a tribute to the training that they get and how you maintain things at the hospital.
Sam, I appreciate those kind remarks, and I agree with you. The difference in our care, although we do have great equipment, state-of-the-art throughout, really the difference is in our caregivers. Not only are they great clinicians and great quality caregivers, but they care not only for patients from a clinical standpoint, but also from an emotional and spiritual standpoint. They have a passion for what they do. And yes, it is a stressful job, but as we talk about, it's not an easy job, but it's really one of the more rewarding jobs that you can ever have because you get to make the difference in the lives of so many people each and every day in such a positive way. And I'm proud of our caregivers. I mean, I go there for my care. My family does, and so many people that I know. And the difference really is the people that are providing the care. We have great nurses, great technicians, even the people that are in our food nutritional services, in our housekeeping department. How they interact with patients every day and how they do their job and do it exceptionally well matters. And our physicians, I'll tell you, they're second to none. And I'm really proud to be part of a team that has done so much so well for this community.
You're doing a great job. When the patients are leaving, they're hugging the nurses, they're hugging the aides, they're sending them flowers or candy, etc. And that's a great tribute to the people who are working up there. Excuse me. When you're talking about, you mentioned about we certainly have the state-of-the-art equipment, and we talked a little bit about that. People really don't understand, could care less about maybe the equipment. However, it's the care,
Absolutely.
The physicians and the doctors and the people that are there. What do you see the future looking like if in healthcare? And thank God we're number one now, but I mean, how do you get better, Jim?
You know, I think, again, it's attention to detail every day. And it's making sure that, you know, as you said, the equipment, we're constantly investing in new equipment. And I think that's what patients come to expect. They don't say, boy, do you have the newest MRI unit or CAT scanner, or do you have the newest machine in the OR? Okay, that's up to us to make sure that we do that, and we definitely do. But really the difference is looking at it and saying, you know, what caregivers do we need to provide that care? And as we go forward, I think you're going to see an expansion in recruitment. I think we're going to be bringing more physicians to this community. Those that are needed in existing specialties, because quite honestly, there are some areas where we need to bolster our ranks even now. But then looking in the future what the needs are going to be. As some of our physicians are getting older, okay? I know you don't ever get any older,
No.
Sam, but I'm getting older and our doctors get older. And you know, we have to keep our eye on the future, not only what we need now, but 5 years from now, 10 years from now. So I think we're going to be doing a lot of recruiting, bringing in physicians from outside to work with the physicians we already have here. We have a great relationship with our doctors. That's really been, I think, the foundation of how we've been able to achieve the quality that we've been able to achieve. But we're going to invest significant dollars to bring physicians here, full-time, part-time. This is where the relationship with Lehigh Valley, I think, will be very important as well, to make sure that we're providing the care. And really the model of care is changing as we go forward. So we're going to have to look at not only what the old model was of the physicians that we're going to need and how they're going to be providing the care, but we're going to need to look at what healthcare is going to evolve into over the next 5, 10, 20 years, and make sure that we have the providers here, the physicians and other mid-level providers, nurse practitioners, physicians assistants, nurse midwives, to be able to make sure that we are providing that quality access to care for this community, not only now, but well into the future.
Speaking of that, I had Congressman Barlett on the show recently, and you know, there's a lot of there's a lot of cons on the Obamacare situation coming in. How is this Obamacare going to affect, you know, the hospital and the services that you're going to have to provide?
You know, there are so many things that are going to change there, but I mean, I think fundamentally, when you look at the very surface, expanding coverage to the large population that you're talking about expanding coverage to, I think is going to put a greater demand for services. And at the very forefront of that will be primary care. So that's one of the areas that we're focusing on, is looking to make sure that we have the correct number of primary care physicians. Part of the reason that sometimes you see the ER does get crowded with non-emergent types of patients is because access to primary care physicians is not what it needs to be. I think that is going to be exacerbated even further when we expand coverage. So we want to make sure that we're doing everything we can to provide a more robust primary care network, working with the primary care physicians that we already have here, because they do a terrific job, but there's only so much they can do. They can't be seeing 150 patients a day. That's physically impossible. You can't maintain the quality. We want them to be able to spend the time with the patients that they need to help them solve their problems and be able to treat them effectively. So we're going to be working with primary care, looking at urgent care centers and opening up several of those in our communities, the communities that we serve going forward, to try to alleviate some of that pressure from the emergency department, do it in a more cost-effective manner. I think patient satisfaction will improve with that, because it's going to be provided in, I think, a much more convenient setting for patients as well. So we're looking at what's occurring going forward under the Affordable Care Act, Obamacare, to see how is that going to really shift the needs and expectations of the patient population in the nation, but more specifically here in Hazleton.
You provide the facility, okay, and you're doing what you have to do, but then there are regulations. When you have Medicare and you have different things, some people say, well, how come I can't get this? And why can't I get this, et cetera? And sometimes I think they have to understand there's regulations that you have to live by at the hospital. Am I correct?
That's correct. I mean, it seems the more paperless our society becomes, the more paperwork that needs to be done.
Yes.
And, you know, it's unfortunate that our caregivers especially spend such an inordinate amount of their time in doing paperwork, which pulls those resources away from where, in my opinion, it should really be, and that's at the bedside actually caring for the patient. So we're continually adding more clinical resources, doing the things that we need to do. Honestly, that pushes up the cost of care. I'm not going to be able to change the system here in Hazleton, Pennsylvania, but we're doing the things that we need to do to deal with the myriad of regulations. And when you look at 2,500 pages more of regulations and policy that gets put into play, it does create an additional administrative burden. And does that impact at times on patients and their access to care and the things that need to do? And maybe not the access so much, but the convenience through which they can get the care? Absolutely. But we're doing everything we can to try to make sure that that patient experience is a positive one for all our patients.
My good friend who died in 2006, Jack Palance, I'll never forget when I did my very first show, and I called him up and I says, Jack, how did I do at my show? He says, Sam, it was good. And I said, great. I was all excited about the first Sam Lesante show I did, and he says, it was good, Sam. And he said, now, how are you going to make it better tomorrow? Okay, and I said, why? He said, now, how do you make it better? So, well, I tried to make it better, and then he says, every time you do something, a show, try to make it better the next time. So in your case, with the hospital doing so well, as you look at it, I'm not going to say a weak link, if there's any weak links, et cetera, but where are some areas that you feel need a little bit more attention? Not that we're not giving quality care, but more attention that, you feel would, just keep on continuing to raise the bar.
I think what we're doing is we're looking at not only access to care in the community, but many times populations, the demographics within our community, people within our community, oftentimes are not going to get that care that they need to get on a preventive basis. Let's say something as simple as going for a colonoscopy once you turn age 50. Different things that can really prevent more chronic conditions from occurring down the road. We're focusing a lot of our time and effort right now in developing programs so that we can do more screenings, that we can catch problems more early on. If it's prostate screenings, or it's mammography, or it's colonoscopy, or pap smears, different things. We're even working with a lot of our doctors right now in trying to detect patients that have problems. I'll give you a very interesting example. I was talking to Dr. Ed Polshinsky, who's part of Alliance Medical Group now, and he conveyed to me that he had a patient that came in for a GI problem. That's his specialty. He noticed when the patient was getting down from the table that they seemed to be in some discomfort, some pain with their back. Well, we've brought Dr. Amar Abbasi here, who's doing a great job. We've started a back pain program with him. He said, he asked him, are you having a problem with your back? He said, yeah, my back has been really hurting me. He referred him to Dr. Abbasi. He said when the patient returned on his next visit, he couldn't stop talking about how great Dr. Abbasi was, and he's helping him with his back. So here's a person that goes, for a GI problem, winds up having another problem being able to be addressed. That's what we're working with our physicians to make sure that we're trying to detect these problems and trying to not only take care of the problems that are sitting in front of us here today and help patients with those, but help them try to alleviate maybe some of the other problems they have and avoid some of the chronic conditions that can occur in the future.
Well, Jim, I can tell you just mentioned Polshinsky and Yamula. Ben, there's a whole Bono, my good buddy. There's so many great doctors we have here, and we're talking about back pain, varicose veins, and the Alliance Weight Loss Program. There's so many programs that the hospital, the Greater Hazleton Health Alliance, has to offer. It's just amazing. And folks, you go to the website. Jim, it's always a pleasure to have you on the show. I mean, the time goes by fast, but I wanted to give the community an opportunity of where we're going, and it's exciting. It really is.
Sam, always a pleasure. Glad to be here.
Okay, folks. Jim Edwards, CEO of the Greater Hazleton Health Alliance. I've been telling you, folks. I'm telling you, from day one, we are just continuing to raise the bar. It's something that's a great opportunity. And kudos to all those people who are working in healthcare today, all you nurses, aides, and doctors, etc., who are working at the hospital in the various places. You guys do a great job, really. And patients, have a little patience with them. Sometimes they're overworked to a degree, but they have a passion, like Jim said. We'll see you next time.